finally got in with a dermatologist. You have all these questions and concerns and just can't wait to be seen. But how do you best prepare for your first visit with a dermatologist? Are you going in for a skin check? Are you going for aesthetic concerns? If I had a magic wand and could get patients to do just one thing before a dermatology appointment, what would it be? Hi guys, I'm Dr. Weinstein. I'm a board certified dermatologist, and today I'm going to share 5 things that I wish patients would know before their dermatology appointment to maximize that short time that we have together. Make sure you tune in. So this video is inspired by a podcast that I recently recorded with Dr. Jenny Liu, and we were talking about how important it is for patients to come prepared to their first dermatology visit. And there are a few things that you might not even think about that are just so important, will help with the ease of the visit and make sure that you get the most out of it. Number 1, so often patients come in to see the dermatologist for a concern. Maybe there was a spot, a rash, just something that was really bugging them. They called to make an appointment, and by the time they get into the appointment, it's gone. This happens all the time. Call it Murphy's Law or whatever you want. But if you have a rash on your skin or a spot that's changing or growing or itching or something that's really bothering you, it's important to take a picture and perhaps document the progression of the condition so that by the time you come into your dermatologist appointment, we can see what it looked like when it started and how it's evolved, progressed, or even gone away. Why do under eye wrinkles even happen? So there's a multitude of factors that contribute. The first is, you guessed it, aging and collagen loss. So as we age, collagen production slows down, leading to thinner skin and more visible wrinkles, especially in an area under the eye that moves quite a bit with your natural expression and also where the skin is naturally a little bit thinner anyway. The next reason is sun damage. So often people forget to put sunscreen right under the eye. Now there are some wonderful formulations that are gentle for that sensitive skin area, and it is so important to not only protect that under eye area with sunscreen daily, but also to wear sunglasses. UV rays break down collagen and contribute to accelerated aging changes on the skin. Next, repetitive facial expressions, so squinting, smiling, and even rubbing your eyes if you suffer from allergies or itchy eyes can contribute to the worsening of those under eye wrinkles. So just be mindful, if your eyes are itchy, try not to rub, try to pat or use a cold compress, something where you're not constantly pulling and tugging at the skin. Now I didn't say not to smile, but certainly squinting can be prevented. So like I mentioned earlier, just wear your sunglasses if you're going to be somewhere bright and sunny. Try not to squint by protecting your eyes from the glare. And lastly, dehydration and lifestyle factors can accelerate those aging changes under the eyes. So lack of moisture, so not applying a moisturizing cream to the under eye area or being dehydrated can contribute, in addition to things like smoking, drinking, and not getting enough sleep. This can all accelerate those aging changes, especially under the eye. Before we start, we really need to understand what exosomes are. So exosomes are extracellular vesicles that are a particular size. Think of them like messengers. They're carrying what we call cargo. They deliver growth factors and signals to your cells. So these can be cells on your head, on your skin, in healing wounds, in non-healing wounds, anywhere really. They're being studied more and more now for their benefit in helping to regrow hair. So exosomes are used widely. They're in various types of skincare, but now they're also being formulated in serums that you can apply to the scalp to help stimulate your hair follicles to regrow hair. One of the key things with hair loss to focus on is overall scalp health. If your scalp isn't healthy, if it's red, if you have a lot of seborrheic dermatitis or dandruff, or if it's itchy or painful, then it's not going to be the optimal environment that you need to regrow hair. By far, the most important reason for wearing sunscreen 365 days a year is to prevent skin cancer. That's right, 1 in 5 Americans will develop skin cancer in their lifetime. And so wearing daily SPF will help prevent the occurrence of skin cancer, especially on the face and in sun-exposed areas. Sunscreen is essential for all skin types. No one is exempt. It doesn't matter your skin tone or your origin or your family history, quite frankly, when it comes to the fact that anyone can develop skin cancer. Now, genetic factors definitely play a role when it comes to skin cancers like melanoma, but with non-melanoma skin cancers, it's really free range for all skin tones. Now, why should we use sunscreen specifically in the summer? If you are a never sunscreen wearer, then this is the time to start, and I'll tell you why. In the summer, the UV rays are stronger, so that UV index is going to be higher, which means the risk of burn is that much higher as well. In the summer, there's also factors like water and sweat coming into play. So if you're at the beach or the pool and you're consistently getting wet and then dry and then wet and dry, no matter how water resistant sunscreen says it is, it still needs to be reapplied every 2 hours. So when you come out of the pool and take a break, it's time to pat your body down dry and reapply your sunscreen. Some common mistakes people make is that they apply full body sunscreen in the morning. That's great before going out to the beach or the pool. And then they're having so much fun, I don't blame you, but they don't reapply sunscreen and then wonder why they got burned at the end of the day. Retinol is everywhere on social media, but no one's talking about the purging, the dryness, or how to use it without wrecking your skin. Hi everyone, I'm Dr. Mara Weinstein. I'm a board certified dermatologist. And today I'm breaking down what influencers are not telling you about retinol and how to use it the right way if you're just getting started. So first of all, what is retinol? Well, retinol is a derivative of retinoic acid. So retinol is a gentler, over-the-counter version of a retinoid, which is what we prescribe in the office. Now, don't get me wrong. I absolutely love retinol and retinoids, and I prescribe them all the time. In fact, sometimes I describe retinol like liquid gold because it really has so many benefits when used properly. Retinol is a vitamin A derivative that works to improve fine lines, acne scarring, acne itself, skin texture, and promote cell turnover. What is not to love about that? 101, let's go. First off, cleanser. There's so many different cleansing options. Which one might be right for you could be different for somebody else. I personally have combination to oily skin, so I like to opt for foaming cleansers, which will help wick some of the oil that I have in the T-zone, but not be overly drying on my cheeks. Second step is optional. It would be a toner or essence. In my case, I brought along these handy little pads by Thayer's. They're blemish clearing pads. They have 2% salicylic acid in them, witch hazel, lemongrass, and aloe vera. I find that when I'm traveling, I tend to get a little blemish here or there. Third step, which is not optional, is your treatment serum. And that's going to be something like your vitamin C serum or your niacinamide or whatever that antioxidant serum that you love. That's what you're going to use next. And so for me, I use this Vichy Lift Active Specialist. It's a B3 serum. It has 5% niacinamide, and also AHA, which is glycolic acid, the sunscreen. So I am a huge fan of Elastin's Hydrotin. I've been a longtime user of this sunscreen. And I have to admit, I use 3 hefty pumps to cover my entire face when I use this sunscreen. Most people think, oh, I'll just use a little dab as my final layer of sunscreen or foundation. No, you need at least 3 finger breaths of sunscreen for it to provide full coverage on your skin and for it to be effective as it says it's supposed to be. This is SPF 36. This is a fully mineral tinted sunscreen, and this has been my go-to for years at this point. So first things first, what is beef tallow? Beef tallow is rendered fat from cows, and it's traditionally used in cooking. But now it's being marketed as a natural moisturizer for the skin. And it's promoted to be similar to skin's natural oils. I've had tons of patients come in, ask me in person and online if beef tallow is good for their skin, what it's all about, and if they should be using it. So let's talk about what it can do for your skin, or what the claims are. The claimed benefits of beef tallow is that it's deeply moisturizing and can be beneficial for dry or compromised skin. It's also rich in fatty acids like vitamins A, D, E, and K. And lastly, it's said to support the skin's barrier and reduce inflammation. So what's not to love? So I'm going to be a little controversial here. I do think at-home microneedling can work, but most people do it wrong and end up hurting themselves. When the at-home treatments might work is if you have a minor skin texture issue, you're extremely careful about sterilization, and you use proper technique and don't press too hard. It's really important to have realistic expectations about your results. Some of the disasters I've seen from at-home treatments are infections from dirty needles, scarring from pressing too hard, and hyperpigmentation from post-treatment sun exposure. Also, worsened acne from spreading bacteria because you're treating overactive acne. So there are some at-home safety rules if you insist. Never go deeper than 0.5 millimeters at home. Make sure you sterilize everything with at least 70% alcohol. And never use it on active acne or irritated skin. Make sure you're replacing your needles after 3 to 5 uses maximum, ideally after each use.